Hey, good afternoon.
Hi,
My name is Farah Martinez. I'm the nurse practitioner. What's your name?
I'm Maria Handel Martinez.
Hey, Maria, do you know the reason of your visit today?
A physical checkup.
You need a physical checkup. Do you know, Maria, what day is today?
February 12, 2025.
All right. What is your date of birth, Maria?
December 24, 2001.
Okay. Maria, do you know, I'm gonna go ahead and do your head to toe assessment. There's some questions that I need to know. And it's related with your health, your family health, and all this stuff. And what do you have any illness?
Yes, I have asthma.
Do you have asthma? Do you take any medication for your asthma?
I take cetirizine.
All right. What about when you have a crisis? Do you have an inhaler?
Yes, I have an inhaler.
All right. Do you take any other daily medication?
Multivitamins, vitamin C.
Okay. And there's anybody in your family that has asthma or any other illness?
Yes, my mom's sides have asthma.
Okay. Do you have allergies? Like allergic to medication, allergic to any food?
No,
No. All right. What was the last time you had a checkup, Maria?
it was last year.
It was last year. Do you know how much is your high?
1.50.
How good is your sleep?
It's good.
How many hours did you sleep?
7 to 8 hours.
Okay. What was the last time, Maria, that you have your period?
It was last month, the 17th.
Do you check like every month you have your period?
Yeah, I have it every month.
Okay. Do you have any pain right now?
No.
You say you don't have any pain. Zero?
Yeah.
Okay. I'm gonna go ahead and check your vital signs.
Yeah.
And then I'm gonna check your weight today. Let's go ahead and check your temperature. 37.1 is your temperature. Let's check your, your finger, top finger. Just breathe normal. Okay, 99 is your saturation and 90 is your heart rate. Let me go ahead and check your pulse and your blood pressure. Your hand. All right, patient pulse. Your pulse is 78. You're fine. Now I'm gonna check your blood pressure, okay?
Okay.
Press your arm. All right, your blood pressure is 110 over 70. It's a good blood pressure. Now, Maria, do you know your height?
I'm 150.
150. Can you go ahead and come here to the scale? I need to check how much your body weight. Okay. 1110. I mean, you have 110 pounds. Maria, there is like your BMI is 19.5, means you are in a normal range. Your height and your weight, they're good. They're in a range that you have a normal body weight. Right now, we're gonna check the patient head. We're gonna observe during the inspection. We can see the head is in the middle of the body. I mean, it's symmetric. If you look each side of her face, there's no tripping. There's no a paralysis like you can see. Hair implantation is good. And now we're gonna go ahead and check her scalp. Maria, do you have any dandruff?
Yes.
Do you use any treatment or any shampoo or anything?
Yes, I use shampoo for dandruff.
Okay. Right. I'm gonna go ahead and check your scalp, okay? Do you know if you have any mass or anything around your scalp that concerns you?
No.
No? There's any pain?
No.
And we're gonna check the patient's scalp to see if she have any active dandruff, if the patient have lysis, if the patient have any bad hygiene that we're gonna refer at the end in a different way. But patient scalp is clean and there is no any mass or anything that we concern about it. Okay, Maria, now we're gonna go ahead and check some other stuff. Can you smile? All right, can you puff your teeth? Your cheeks, sorry. Okay, can you raise your eyebrow? That way we're checking her face muscles and they are fine. Now we're gonna check the patient's eyes. We are gonna look for the eyebrows if it have the same implantation and it have all the hair. There are some illness that the patient lose the part of their eyebrows. We're gonna check the eyelids. Both eyelids are normal. The sclera, the conjunctiva, and the iris are normal. There's not irritation or any color change or anything. We're gonna check the mucous membrane. I'm gonna pull your that area down to look for if there's any color change or anything. When the patient have anemia, we can check like the little polyp area in the eyes. Now, Maria, can you look at the distance? I'm gonna check your eyes. Just follow this pen, and I'm gonna approach to your nose. Follow the pen. All right, now we're gonna check your ocular muscles. You're gonna follow that pen all the way up, the way down. Now to the other side. Now this side. Now to the sternal angle, and to the other side. I mean, patient ocular muscles are good. Now we're gonna check pupil accommodation. Pupil construction to the light. Maria, I'm gonna approach the light to your eye to check how your pupils react. All right, and check the other eye. Pupil reaction to the light are normal, and we are not seeing any aniscoria on the patient or any other alteration. Now we're gonna check her nose. Her septal nose is normal. They don't have any deviation. Maria, do you have any problem when you smell?
No.
No. Can you occlude one of your nostril and blow through the other one? All right. Can you check the other one? We're checking the patency. If the patient do not have any obstruction, now we're gonna check inside of her nose to see if we can see with the light any septal deviation or any polyps, and we can check for the mucous brains too. Maria, I'm going to check your nose. Can you tilt your head a little back? There is not any visible deviation or polyps or occlusion, and mucous membranes are moist and red. Now I'm going to check the patient ears. We're going to check the external ear. Maria, I'm going to check your ear. Just look to the front. External ear is normal. There is not any alteration. Do you have any pain, Maria?
No.
If I pull your ear, do you have any pain?
No.
In the adult patient, we have to pull up and outward to check the external ear. I would check the external ear with a light. There's not any visible alteration. There's no secretion, any bleeding or anything. We're not seeing any wax outside in the ear canal. And I don't have any otoscope right now. And this in my hands, but if I check the tympanic membrane, I will see the tympanic membrane. That patient should be normal without any alteration. And now we're gonna go ahead and check the patient's mouth. Maria, I'm gonna check your mouth from the outside. We can check the patient's lips. We see like a little dryness in her lips, but there is no any open area or bleeding from the outside. Now I'm gonna check the patient's mouth inside. Maria, can you open your mouth? And what we're gonna check is we're gonna see her cheeks from inside. The mucous membrane are hydrated, means we can see the patient have any dehydration. We have to check all her teeth in the upper and lower area. If the patient have any cavity, there is not. My patient do not have any cavity. You can close your mouth for a minute. We can check her mouth is moist and is with a pink color, that is normal. Her tongue is not dry, don't have any crack or any alteration. Maria, do you have any sore in your mouth or something that is bothering you?
No.
Okay, can you stick your tongue out? All right. With that way we check the glossopharyngeal, and I'm also gonna check her reaction. Maria, I'm gonna go ahead and introduce this in your throat to see, not very deep, just to see your gag reflex. Okay, open your mouth, stick your tongue out. Okay, gag reflex is normal and is good. I'm gonna check, Maria, the back of your throat. What is your pharyngeal area? And to see if there is any redness, any alteration. Okay, open your mouth, take your tongue out. Her uvula is in the middle, and when I stimulate, the uvula is pulling back. There is not any pharyngeal alteration, and everything looks normal in patient mouth. Now we're gonna go ahead and check some cranial nerve. Maria, can you close your eyes? I'm gonna give you something to smell, and you're gonna let me know what you're smelling. Okay. What did you smell, Maria?
Vanilla.
All right. We can check. We know the patient olfactory nerve is conserved, and it's good. Now, Maria, close your eyes again. After we finish shaking the patient's head, face, we're gonna go ahead and check her neck. I'm gonna pull your hair back a little bit to check your neck. Okay, and during the inspection, we can see the patient trachea is in the midline. Now we have to check for any tumor or any color change or anything like that. Maria, do you have any pain when you move your neck?
No.
No, there's not any concern about it. Okay, and I'm gonna check the jugular venous distension. Can you turn your face a little bit down there? There's not any distension in her neck to the other side. There's no distension or anything. I'm gonna check the jugular pulse. I'm gonna check one side. We cannot check both eyes at the same time. and it's 2 plus. Now we're gonna check for any bruit, and let me listen. Now you can turn your head a little bit down there. Now I'm gonna check the other side. And it's 2 plus either. Gonna check for bruit. No any bruit that I can hear. Maria, we're gonna check the movement of your neck to see how your muscles are. Can you check and move your head to different sides, like to the side, one side, now to the other side. And try to touch your chin with your thorax, and now the extension back. Okay, means all her neck muscles are working normal. And there we go. Now we're gonna check the lymph nodes. Maria, I'm gonna touch your different part of your neck and behind your ear and in the front of your ear. You're gonna let me know if you feel any soreness or anything, okay? And at the same time, I can go ahead and check the patient masses around here, going down to all her neck. Any pain or anything? No? Okay, everything is negative, okay? There's not any swelling or any mass that I can feel. I'm gonna go ahead, Maria, and check here are those muscles. Can you open and close your mouth? Okay, there's any pain that you feel?
No.
No? All right. Let's go ahead and check your arms. Can you extend your arms? And the first thing we're gonna look for is any color change, any swelling, and any bruise that the patient can have, or any deformity. And she had both arms are the same. We check skin turgor to see if the patient have any dehydration, but skin turgor is normal. And let me check. All right, it's less than 2 minutes when you check in both nails. And nails are short, but they don't have any alteration. Okay, Maria, I'm gonna go ahead and get your arm. I'm gonna do some movement. Do you feel any pain?
No.
No? That hurts?
Mm-mm.
Means her Reynolds motion are normal. Let me see your arm. No pain, Maria?
Mm.
Her fingers, oh, they don't have any deformity. You can check some patients. They have arthritis or they have rheumatoid arthritis. They have deformity on their fingers, but she don't have any deformity. And the last thing we're gonna do with the upper arm is, Maria, you're gonna close your eyes and you're gonna extend your arms. Can you extend your arms? Okay. All right. Just put it down. Patient don't have any drift on her arms. Means that is normal. Now, Maria, we're gonna check your thorax. And in your thorax, we're gonna check your heart and your lungs. During the inspection, we're gonna see if the patient have her thorax is symmetric and there is no any alteration in anterior posterior diameters are normal. We can see she has some moles, but she don't have any old scar or color change or anything. She has some little marks on her back. They are for previous acne. And Mary, I'm gonna go ahead and check your heart, okay? You're gonna breathe normal. I'm gonna check your heart. and her fifth intercostal space, mid clavicular line. We're gonna check in here. Excuse me, Maria. I'm gonna go ahead and pull this way, Maria. Okay, and here. And we're gonna check the mitral point. What is the maximum impulse to check the mitral? There's not any alteration. Now we're gonna check for a brood with the other side of the stethoscope. For a brood. Now I'm checking the here, Maria. Excuse me. There's no any fluid or alteration. Both looked are normal. Your heart means everything is fine. Let me check your lungs, Maria. I'm gonna check front and back, okay? And you breathe in and out normal, okay? Move your hair. Breathe in and out. All right, Maria, your heart and your lungs are normal. There's not any alteration in your lungs. There's no crackles or anything that they demonstrate that you have any asthma crisis or anything like that. Means you're good. And your heart rate is good from the beginning when we check your vital signs, and all your heart valves are normal. Right now, we're gonna head and check your abdomen. Can you go ahead and lay down here? I'm gonna check your abdomen. I have some question for you. There is any pain during urination?
No.
No. And are you drinking enough liquids during the day to go into the bathroom very often?
Yes.
All right. And I also want to know, like, do you have any, like, a regular bowel movement?
Yes.
There's no pain or any bleeding when you go to the bathroom or anything that may concerns you? Okay. Now, we're going to inspect the patient's abdomen. First, we're going to check her breathing. And we can check for a minute, like we check her breathing before. And patient have 18 respiration per minute when I check the vital signs. During the inspection, her abdomen is not using any accessory muscle during the breathing, same like during her thorax inspection. She was not using any accessory muscles. There is no any air scarf, and there is no any mole on her abdomen or any alteration. Color is normal. Now we're gonna check her bowel movements. You have a normal bowel movement. Maria, I'm gonna keep going with your abdomen check. Maria, I'm gonna palpate your abdomen now, okay? You let me know if you have any pain.
Okay.
I'm gonna do superficial first, and then a little deep. There is any pain?
No.
When we do the deep palpation, we're looking for organ enlargement, which is negative in my patient. All right, Maria, we finished with your abdomen. Now, Maria, we're gonna finish with your head to toe assessment, checking your legs. We have to inspect the hair growth. It's normal and in both legs. And there's not any swelling, visible swelling or redness or any alteration. Do you have any pain, Maria, in your legs?
No.
No. Okay. We have to inspect patient's toenails to see if there is any ingrown toenails that you don't have it. And we also have to check the patients to see if they have any ulcers. Some diabetic patients have ulcers in their feet. They don't even realize it because they lose sensation on the lower extremities. We're gonna check to see if a patient have any swelling during palpation. I'm gonna palpate here. I'm gonna palpate the other leg. And around here, there's no any swelling. Now we're gonna check her pulse. The palpatile pulse. Both are equal, bilaterally, and 2+. We're gonna check the posterior tibial. And there are 2+ bilaterally equal. And the dorsal pedis. Okay. There are 2+ bilateral and equal. Now we're gonna check the patient muscle strength. Maria, first I'm gonna check your range motion. Can you bend your knee? Okay. There's any pain when I move your joints in here? What about here? Any pain?
No.
Any pain when I move in here? No. Okay. Now, Maria, you're gonna push against my hands. Push. Okay, we're checking the muscle strength on the patient. Now you're gonna push, I'm gonna pressure down and you're gonna push out. Okay? Okay. Perfect. Patient range of motion are conservative. All the muscles are normal. Now, Maria, we're gonna check. Last thing we're gonna check is the Babinski reflex. Babinski reflex is normal. Maria, when you feel that, your body's gonna have a normal reaction. Okay. And it's normal. And with that, Maria, you can go ahead and sit down. Well, Maria, we finished for today. After your head to toe assessment, I can let you know everything's fine. And we discussed at the beginning about your BMI, but it's normal. You need to keep with your healthy eating habits. And do you need any refill for your medication, for your asthma inhaler or anything like that?
No, thank you.
No, you're fine? Okay, if you need it anytime, just let us know. And we will order a refill for you. I want to let you know everything was okay. And we can see you next year for your next follow-up or your next physical. And if you have any concern before that, you can call and make an appointment and we can check on you.
Okay,
Right? You have a good afternoon.
You
Nice
too.
to meet you, Maria.
Nice
Bye.
to meet you